Is the motion be agreed to? And I call the member for Robertson.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I rise to present a petition to the House of Representatives that has recently been presented by the Petitions Committee and found to be in order. The principal petitioner is Marlene Clintworth from Kincumber in my electorate of Robertson, who has received supporting signatures from members of my community on the need for more lymphedema services. The petition is signed by concerned members of the public and their families, many of whom are based in my electorate of Robertson on the central coast of New South Wales. And specifically, people who have signed this petition are calling on the House to act on a shortage of qualified therapists who are able to treat lymphedema. There are also more than 500 others who have signed their name in a related petition organised by the roving Ruby's Red Hatters of the Central Coast. And I'd like to start by commending Marlene and the Red Rubies organisation, who have been tireless in their efforts to have this matter not only formally recognised, but they're also very strong advocates in my community to raise awareness of lymphedema, its very serious impacts and the need for more qualified therapists. And they've met with me and they've explained why this disease and the need to have more qualified therapists treat it is such an important issue in my community. And as the petitioner's letter to the House indicates, lymphedema is recognised as a serious disease, and it's a side effect of having your lymph glands surgically removed during cancer surgery. It impacts men and women of all ages. And there's a particular concern in my community about the availability of local services to help treat people with this condition. I understand that currently there's only one part-time therapist employed at our local public hospital, and I've been advised that this therapist is also required to assist people with hand and feet therapy needs. On the Central Coast, those people who have signed this petition have told me that this can result in wait times of around 7 weeks for an established patient to be able to start treatment. Madam Deputy Speaker, this would have significant impact on our local families as well as on the people who actually suffer lymphedema. There's a desire to see more awareness of this disease, a desire I support, and I'd really like to spend a short time describing what lymphedema is. According to information from the Federal Government's Cancer Australia body, lymphedema is a regional accumulation of excessive amounts of protein-rich fluid in body tissue. It causes swelling and usually affects the limbs, although it can also affect the trunk, breast, head and neck or genital area. It can be acquired following surgery, radiotherapy, trauma or other damage to the lymphatic system following treatment of cancer. Conservative estimates suggest that at least 20% of survivors from breast, gynecological and prostate cancer, or in fact melanoma, will experience lymphedema. And in my view, that statistic of 1 in 5 is quite concerning. Key risk factors include the extent of the surgery, lymph node dissection and radiation treatment. Other factors include trauma, infection, body mass index and immobility. Of course, Cancer Australia says that intervention at an early stage can significantly reduce the risk of developing lymphedema or reduce the severity if it develops. I'd also like to acknowledge that this matter was raised in June by the Senate Select Committee on Health during a discussion on health policy, administration and expenditure. The member for Brisbane has also spoken up about this issue, and I do want to thank her for doing so. She said that for many sufferers, ordinary everyday activities can be difficult and their quality of life is really affected. The member for Brisbane pointed out that this can particularly be the case for lymphedema sufferers when the effects of hot and humid conditions increase swelling. So as we approach the warmer months of this year, and particularly on a hot day like today, what a better time than now to raise this issue in the House. So may I again thank Marlene Clintworth and all of the members of my local community who have raised this matter with me passionately, with sincerity and with determination. As the petition states, we ask the House to act on the shortage of qualified therapists who are able to treat lymphedema. In particular, this is impacting residents in the federal electorate of Robertson. This is considered a Commonwealth matter under the purview of the Department of Health, who would also be well positioned to raise awareness of this issue on a national level. I present the petition to the House.
I thank the member for Robertson, and I might just add, I want to commend you on your work. My mother was one of many sufferers of lymphedema, and I know how important it is to obtain better treatment.